So can you please, okay, the biography. She is known for her expertise in the area of health-seeking behavior, social determinants, and participatory action research related to population health. As a public health physician with 10 years experience, working in the Ministry of Health at various levels, from the health clinic, hospital, managerial level for program-based planning, monitoring, and evaluation in family health. Scope services, in particular, the maternal and parental health. So without further delay, I would like to invite Professor Dr. Rosnah Sutan for her presentation. Group presentation. Thank you.
Thank you, Prof. Michael. Allow me to share my slide. Okay. Assalamualaikum, good morning, and salam keluarga Malaysia to all participants of the 24th Medical and Health Research Week. I'm here today to captive your all interest in conducting population health research. So, in UKM, we have UKM research clusters, and there are 5 big research clusters served by researchers of UKM. Today, we have looking at one of the research clusters, which is Advanced Medical Health Research clusters checked by Professor Dr. Nofiza Mokhtar. So this is the one of the 5 clusters, and this is the 7th focus group, and I'm under the public health focus group. So we talk about population health. So we have heard earlier showcase presentation, and now it's time for me to showcase some of it. So the scope of research is based on major public health issues, but does not overlap with other research groups on fundamental needs, like diabetic, degenerative disease, our research group, non-communicable disease, infectious, etc. So I am the head of the population health research group, and I involved in population health research for more than 20 years, and I have more than 50 students completed their research and show their output to be utilized for creating new concepts in fundamental research or solving problems in applied research. With the research knowledge, they become an experts nowadays in their field scope. So, So as an outline of presentation, so these are the outline. So introduction to the population research group, scope of the population health research priority, showcase examples from members of the group, and the future direction. So as the population research group, population health research group address determinants of health research, and equity in promoting well-being. So as we know that population health research group, normally we deal with big data. So we need to know how to linkage all the data and try to explore the determinants to the outcomes through various research methodology approach. If you know that in population health research, we have many experts who are very good in the methodology and statistical component. So the goal of the public health research is to prevent disease, as what that you all know. Yeah. But actually, we are not only preventing the disease, but we also looking in terms what factor, what component that can influence the population health. So such as like healthy lifestyle patterns. So scope of population health research covers, this is the 9th scope: social determinants of health research, quality of life research, behavioral science diversity, which is involved in the minority group, refugees, health equity research, health service research in terms related to the system, healthcare delivery, and the methodology tools that we are going to use. And then healthcare economic and case mix, health measures in terms of looking for the performance in a performance assessment, health innovation in education, health monitoring and evaluation. So all of these, actually, there is some priorities that under Rancangan Malaysia ke-12 as well as the SDGs and whatever the KKM priorities. So normally what that we do, we need to follow what the country requirement. So these are the 6 components that are being a priority. So preventing diseases through determinants of health, improving primary health care and medical care, promoting health and enhancing behavior and health policies, environmental health, occupational health, and the last one is health economy. So this is the list of our population health research group members. The majority are from the community health department. Yeah, so we have a list of community health department staff, but we do not have. But we also have some other department, such as like for medical, it's led by our dean, our postgrad deans, and others. And then from family medicines, yeah, from psychiatrists, from nursing. From I also, and then from emergency department. And for other faculty besides medical, also some also involved. Like these two are from allied health science. Yeah. Some people like to do population research but may face challenges, yeah, on how to conduct and complete their research. Our team is very keen to help, and so please contact us. Not only contact me alone. Yeah. Today we will show you a few of the research on the population health from our research project as a showcase. So dreams need the effort to make it happen. Yeah. So forming the population health research group in a top-down direction leads to big challenges that we need to face. Before we have this research ideas cluster, every one of us had already started our research work in various ways, but not in a specific team like population health research group. The population health research group is newly formed and academicians voluntarily enrolled into this group. As usual, financial and manpower support is always a matter as a start, and not to mention infrastructure and facilities. As our team comes from different research exposure background, we need to refine our scope of research, listing of our strengths, tools, and goals for future direction, not like what that you have learned before from other groups. They are very structured because they already start early. So now I need to showcase in 20 minutes. That is another challenge for me because we have very big and very diverse scope of research. In the next slides, I'm going to showcase only 5 members of the team to help you understand research in population health in a better way. I hope you all can see the way the research was conducted and how it can give an impact on the society and the healthcare system, because our subject is on population health. So the next slides. So I start one by one. Yeah. So I think everybody knows him. Yeah. So let me introduce our first member of show as a showcase, Prof. Dr. Muhammad Rizal. His main areas of research are cost effectiveness analysis and quality of life. Being a researcher as well as academician, we dream of success in grooming our students for excellent thesis and good impact on society and healthcare. A recent completed research project under Prof. Rizal, he managed to have a student graduate on time with an excellent thesis. Yeah, so this is the certificate. His research output on the projection of the economic burden on end-stage renal disease to the public sector in Malaysia has been taken up as an evidence to the development of the renal transplantation program. So this paper, as a policy paper, being presented to Minister to come up with the renal transplantation program. So next is Prof. Dr. Anisa. Her main interests are public health, health management, quality of care, and health economics. Recently, she has a doctoral student who graduated on time and managed to come up with a good numbers of high impact factor journals. And also his student output is being used to revise the program to better serve society and healthcare plan as the family doctor shared program. So now we go to our strength. Yeah? In the population health research group, the case mix is another strength we have in ACTM. Prof. Dr. Azimatul Noor is the head of the International Case Mix and Clinical Coding Center. Many ongoing type of research are supervised by Prof. Dr. Azimatul, and you may have some interest to explore more of her research project, so please contact her. Yeah, So now conducting research vigilantly will drive us to become an expert in the field. In environmental health scope, Prof. Dr. Muhammad Hasni is well known locally and internationally for his expertise in toxicology. Through several types of research and consultation, you will become an irreverent person for others like him. So please contact him if you want some tips from him. Okay, next is about collaboration. The ability to collaborate for financial research and manpower support is highly demanding in view of conducting big data collection. Prof. Dr. Rosita Hood has several collaboration MOA with industries, and she has managed to publish the highest number of Q1 journal for this year, 8 papers, under our Faculty of Medical Science. So next one is, so I think everybody knows him, or maybe some of you know him because he taught you all in first degree. So occupational health is another scope of population health, and Prof. Dr. Nur Hashim is an occupational health expert who have many research collaborations with industries. He has been awarded as 2% scientist by Elsevier through his collaboration with international multiple countries cohort research project titled Pure Scientific. So this is groundbreaking research, and UK, I'm very proud of it, and been published in the Straits Times for the big input that bring up UK and news. It will give an eye-opening that nothing is impossible if you know what you want, how we should do, and organize our research. The important thing is about organizing your research. So now let us see how this can give you some solution for planning your research. So look at how the research will give an impact to us, our organization, and society. So because in population health, we are not looking only for our interests, but we are looking for to serve our immediate societies as well as of the organization with healthcare delivery. Some research may find a hard time getting the research findings output as a key message to deliver and engage with people stakeholder. So let me show my showcase. So I involved in a consultancy research project with other members. So these are our members of this grant, and we get collaborations from Pakarunding. The grant actually is under Kementerian Pembangunan Wanita, but been given to us to Institute of Social Malaysia because it's social science. And we come up with the papers, and we publish in a Q1 papers, and we come up with a research project. We completed the research project, and we come up with a books for reference. So the book have been used by the Kementerian Wanita and others for planning on in terms of the LTC, which is long-term care for elderly. So our survey findings, sorry, I have to present in Bahasa Malaysia because this is the thing that we present to the Kementerian Wanita and to guide them in terms of come up with policy about long-term care. So and we propose some models that we think that is suitable to in facing of year 2030 when we are known as an aged country. So we come up with many types and make the framework confused so that they will come back to us to come up with a pilot study in terms of testing our concept to come up with the long-term care at the community base. So finally, I think this is my last slide, just one more. Time is already 11:25. So outline the social ecological model is one of the theories that normally that we use in population health. Because in population health, we're not only interested on individual patients in front of us, but we are looking on population in a bigger group behind the 1% in front of us. So normally we are looking into order from micro, meso, and macro level. So the macro level is more on the organization, which is healthcare delivery, the policy in terms of planning and monitoring of the programs. So whatever that we come up with the research, normally we try to angle in terms of the indicator performance. So our indicator performance always been measured in the public health department in the Kementerian Kesihatan. So we help them, we collaborate with them so that we can give some input from our university level for them to measure and report in their report yearly. So I think that is my last slide from the population health group. So I think that as a researcher, we need to keep going. Even though we may fall down, we need to get another alternative ways. There's no such a nice highway. Sometimes we need to swim, we need to use some boats to go to reach our goal. Yeah, so basically in population health, we are dealing with data integration. Normally we love looking on the data, even though like clinician looking on the patient as a comprehensive assessment, but normally at population health researcher, we looking not only a patient, but we also support and link with other data and looking at a bigger contact in a macro level, in meso level, so that we know better our population. So from there, we try to stratify, come up with a good design so that we use our data as evidence. And normally we use a tool that's validated. So if you are students are in our department, number one question that we ask is, are this tool are validated? Yeah. So and the idea is, normally we always reflect that the output of this research should be beneficial to healthcare delivery, so that it can improve into our planning and monitoring. And we don't forget that we get the fund actually is direct from committee. So we need to serve back. Sometimes when we do research, we do a community services. So we go down to the grassroots and meet them and provide whatever service that we give. Normally we do a health promotion camp. And then through that, we get some feedback, how that make sure that our research can be sustained. So from there, we help in terms of add on evidence for the better reference. With that, I think I thank you and I pass back to Prof. Haikal. Thank you.
Yeah, thank you very much, Prof. Rosnah.